Dr. Ravi. I'm an infectious disease, wound care, and obesity medicine doctor practicing in Georgia. And basically, my conflicts are removing barriers to healing for infections, wounds, and obesity. I'm working on a telemedicine solution for that, but I'm very active in social media, trying to spread the knowledge of metabolic health and role of infection and wound outcomes when related to metabolic health. My goal is removing barriers to healing, and basically, I'm going to present a case of a gentleman who has had a 70-pound weight loss. This is a nice, a 53-year-old male trained engineer who has had long-term work on train, and he has had unscheduled eating times and drinking a lot of sweet tea to maintain his sugars to prevent the jitteriness, and ended up gaining weight and having cardiac events that warranted cardiac catheterization. And lucky for him, he had a clean cath, but also he had other issues including high blood pressure and joint pains, leg pains, and also gout, and ended up working on his metabolic health with his losing around 70 pounds from 263 to 193 over 9 to 10 month period. And essentially, he was happy with his results and has consented for a patient perspective interview. And as you see here, his waist size is improving. His also the waist to height ratio is improving. His insulin level has come down from 31 to 13, and his lipoprotein insulin resistance score has improved, and his uric acid level has come down to 9.4 to 6.2, and his body fat percent that was checked out is reduced. We'll get to a detail on this one in the next at the end of the slide, but let's hear him talk to us.
Hello. Thank you for coming today. So, tell me, what made you come in today?
I have a job that I work all hours of night and day. I had been feeling not so good and overweight. I had a heart cath done last year, which kind of got my attention. No blockages or anything like that, but I've always been a little heavy because I like to eat.
Oh, okay.
Like
everybody likes to eat.
You right.
Yeah.
And so give me a little bit more to eat and I'll be happy. But I did not know what to eat. And I knew that I needed to lose weight. And so I came to you when I found out about you.
Yeah. So this family history, you said that your father, everybody had some heart issues?
My mother's side really didn't have any heart issues to amount to anything, but the diabetes was all through the family.
And then you have young kids and you wanted to be a role model for them. That's what you told me.
And try to be there as long as I can for them.
What were the complications of weight that you had that was bothering you?
Well, I felt bad some of the times. Sleep was not good most of the times. I've had some sleep issues. And so,
how about gout and all that?
Gout, I have to take, or did have to take, I haven't taken in a while, the gout medications, which I don't really enjoy doing, but if you have to, you have to. Since I started with you, I've come off some of that medicine.
Yeah. So basically, you lost around 70 pounds of weight since you started with us.
Approximately 70 pounds.
You look totally different. I didn't even recognize you with all the beard and all that today.
Well, as I told you earlier, I'd gone to church and a guy came up to me and said, "Are you okay?" I said, "What happened? What have you done?" And I said, "Well, I've just lost weight." "Are you sick?" I said, "No, not that I know."
So that's something. So remember, if you remember, what did I explain you in the beginning? How did you understand what I explained the process?
I used to have what I call the shakes, which are sugar level spikes, which if I didn't eat right or if I ate too many sweets at one time and then didn't eat, I would have the shakes and feel bad where I'd have to rush and get a soft drink to pump sugar in me. And you explained to me that my pancreas was a dam and I wanted to control that dam and that insulin level to where it was not putting insulin in my body and just filling my body with insulin all the time.
Yeah.
And that got my attention to where I could kind of put two and two together and understand what my body was doing when I ate sugar, when I ate anything really, but when I ate the sugar, my body would go berserk. Yeah. That's the bottom line.
So basically, your insulin level at the baseline was 31, and now with this today's the last blood work you had, the uric acid level is normal. Your insulin level has come down to 13. I would like it less than 10, but I'll take this because it came down from 31 to 13. So your body is self-sustaining. But what you're in fact, when you started, we had some issues, and we did not do the body composition testing. But in this body composition testing here, you really are doing amazing. You still are in the overweight range as per this one, but your fat mass is only excess is only 14 pounds. And then basically all you need to do is do some weight lifting and increase your muscle mass, and rest of it will get better. And my target for you is to improve your muscle mass and reduce your basically have a structured weight building, so muscle building. So the goal is to do some band exercises and some muscle building. So how is your diet otherwise? How is your symptoms of gout or any? Are you at your work? Do you lift anything or do anything?
No, we don't. I don't do a lot of lifting at work. I have to do that on the side because the hours. One reason why we're inside of a cab. I drive trains, so it's a little bit different work. And there's no normal hours. It's all hours night.
So my next goal for you is to understand what I call is a glycemic variability. So you are doing amazing. If you are interested, what I will give you is a telemedicine technology tool, which I already gave it to you, and you've been kind of on and off using it. But what I want you to do is try to take. I'm going to give you a script for a glucose patch, like that monitors the continuous glucose monitoring thing, where I'll call it into your pharmacy, and it costs around $75 a month. If you're interested, I want you to see what your food does to your sugar levels in the body. If you're interested, I'll give you that. And then by tracking your response to your food, you will understand that your glucose levels have to be stable. In an EKG, we want a wave. In a glucose, we don't want a wave. We want a flat line. So flat line in a normal EKG is dead, whereas flat line in glucose is stable. That's what we want. So good. Thank you for coming. I'll see you back.
Hello.
So basically here, that the main take-home points is losing fat mass improves metabolic fitness, and lifestyle is very important. And weight loss is a good side effect of a great lifestyle. So in a in a female, the body fat percentage for 30 to 39 years of age is anybody more than 30% is obese, and 31% for 40 to 49-year-old female, and 35% for a female more than 50 years. But for a male, the body fat percent more than 25% is for 30 to more than 30 years. For 40 years, it's 27%, and 50 years also the same. So what I decided to discuss also as a endpoint for this quickly is creating a wellness journey for patients is very significant, and trying to understand the genetic and the nutritional impact of food on the genes and outcomes of the person is very important. And also high blood sugar and metabolic fitness that are both related make a difference. And we need to create a closed loop biofeedback, as most individuals are bio individuals, and we have to get away from mass medicine mindset. There are many programs that are out there, including diabetes prevention program that help with this weight loss, but fat percent loss really is going to determine what's going to happen with a person's metabolic health. Hence, I think we need to focus on fat mass loss to target fat mass disease. Thank you very much.